demo presentation on how to use HealthServe to manage patient information in pharmacy. Most of the work being done by pharmacists, both in the hospital and the community pharmacy setting, is lost into thin air simply because there is no consistent documentation of patient care provided by pharmacists. And so, the aim of this demo is to illustrate to us how we can embrace digital documentation to improve patient care and to also engage the public and policymakers on how best they can utilize the services of pharmacists to advance primary health care. So let's get started. The first thing you need to do if you're about to onboard on HealthServe platform is to create your institutional account, and you start by going to your browser and type health, then serves, meaning HealthServe .org. You click enter and it will bring you to where we are when we started, which is HealthServe. So now you are in HealthServe. Click on this square that has 3 blue line within. So I've done that, and once you drop down the menu, that which actually holds the menu on mobile interface, click on register, then select institution registration. Now once it opens up, register your institution, starting with the selection of the type of institution. In this case, we're looking at pharmacy. We call the pharmacy ABC Pharmacy, for instance, and say the email is ABC. Assume the email is ABC abc@gmail.com. Now you need to confirm this email by putting it here as well, and make sure it's correct. Select your country. So let's assume the person doing this is coming from Ghana. So we go to Ghana. Okay, that's Ghana. And then location in Ghana, you specify maybe Kumasi, right? Then telephone number, you put the phone number. You don't need to put the country code. You can see the country code is already here. So just put the phone number as the case may be. Please put it as given by the telecom provider by putting the first 0 there. Then repeat it again. Put it again. Put the address. Kalongo. Just type whatever street. Kumasi. Right? Alright. Then you put the name of the contact person, maybe Pharmacies Frimpong. Then password, you set your password, something best known to you, and also repeat the password here. Put the date of establishing your pharmacy by clicking on this small arrow pointing downward. Let me do that again. I want to close this. Cancel. That's this small arrow, touch it. It will open this calendar. Now when this calendar open, don't start doing this date like this. This will take you so much time. Just go to this place you see 2023, touch it. It will give you a drop down like this. Slide it to the date when you open your pharmacy. Let's assume it's 2000, and then let's assume it's December 6th. It says set. Then if you have logo, you put it there. Then you are going to enjoy 1 month free access on this system by putting digital health. I'm just doing this to make sure that our people can do this without any issue. Then check on this I am not a robot. Please always do that when you're registering. And you're done. Just click on register. You will get a user ID. Now let's head on to login page. So you click on that icon above, login. Right? So at the login page, you can use your user ID given to you by the system that will look like any of the things we have here. Or you use your email you used to create the account, that abc@gmail.com that we use then. So I go ahead and log into an account. This is the account I want to log in and check. I'm not a robot. Login. Now you're in. So the first thing you need to start doing at this stage is to onboard your staff, because pharmacy does not work without human being. So you need a human being to run operations in it. So in that case, you click on enroll/delete staff. And there are two ways to do this. The staff, from that point where you created your pharmacy account, there is also staff account, as you can see from the register drop down. They can go there and register their staff account, or you register for them here. So if you want to register for them here, just simply click on register new staff, fill this form just like what we did before. Image is optional, and click add staff. Then put a password they'll be using to access the account in your pharmacy. Then the job is done. Okay, alright. So let me also go back and show you the other option. The other one is for you to put the staff user ID. Assume the staff user ID is a PHS 00001 AAA. Assume this is the staff ID. You go ahead and click on enroll staff, and the person will be added. Say this account does not belong to a supporting staff, so obviously the account does not exist. That is what it means if you try to do this. All right, because I typed the wrong user ID, so that's why it's saying the account does not exist. Okay, so once you enroll your staff, you will see all the enrolled staff in your institution. Here you can see all the staff that have been enrolled, and you can remove them. Any of them that is no longer with you, just simply click and say yes, and you strike them off and they won't have access to your system again. Right, let's move on. Remember, we're talking about pharmacy operation, so nothing concerns us with the lab medical investigation here, so we'll leave that aside. Then here we see all our documentation, patient register, vaccination, and all that, family planning, pharmacovigilance report, poison, drug recall, and so many other things. So these are some of the data you'll be fetching from the system while you use it for this purpose. Also, there is telehealth services, and this is actually to give you maximum visibility online. So if you go to pharmacies on this system, it's going to show you all the various pharmacies that have signed up on health staff, and patients can actually engage with you online and try to find out services you provide, the product you have, and they can actually seal a deal with you. All right, moving on. We haven't started clinical documentation. We're just trying to review the system. Then this is patient visit record, but it applies more to hospital where they keep record of patient scheduling, where they make use of patient scheduling system. This is drug labeling tool. Here you can generate labels both from prescription and custom labeling, and you can see some already labeled drugs here. You click on, let me just show you one of these labeled drugs here. I click on print label. That is the label here. I want to close the printer interface that's popping up. So you can see the label. This is how your label will look. I loaded it again. So patient name, medication, dose, who dispense it, and any information like avoid alcohol consumption, name of your pharmacy, address and phone number, and even email if you want to. So this is what the labeling system will look like for your pharmacy, and there are many ways to label, from prescription, from custom label, and you can even customize the setting here. Here you can adjust the label the way you want it by changing the font size from maybe 14 to something smaller or bigger as you want it. Font style, you can change it. You can see area. You can use any other option. Then you can make it bold, or if you don't want bold, you can make it normal. Right? This last one, font size mobile, is for your mobile setting. While this one is for computer option. This system works in both mobile and computer. Right? So once you finish setting, you click on submit details and it will be visible and active in all the staff working in your institution, including your own pharmacy account as well. So if you want to view the label template on mobile after setting it up, click on mobile preview. That will help you to see what your label will look like. So this is what the label will look like. All right. So that is about using HealthServe to label drug. Still on what you can do with HealthServe, you have your appointment management here. If I open it, it has all the appointment. Then you have communication setting, because with this system, you can actually engage your patient in virtual communication. There's also various tools for health insurance. There's bill and commission management, revenue analytics, staff activity evaluation. You can also consult online. And the more interesting is that you can also earn money by referring people on HealthServe. What do we mean by this is that if you like HealthServe and you talk to your friends that you know that is into lab operation, pharmacy operation, hospital operation about HealthServe, and you copy this your referral link here, just click on copy, it's copied. Just share it with the person, maybe on WhatsApp, on LinkedIn, or any of the social media, or even send it through email, and they use it to sign up. System is going to show you when they signed up, and once they activate, system will credit you for the amount, 10% of the amount paid for the activation. So you can see this one, this person has activated, and this person earned 950 naira for the amount paid, which is 10% of the amount the person paid for this activation, and that is 950 naira. And for you to withdraw this amount, simply click on withdraw amount, and you put your bank details and click on withdraw, and the money will be sent to your account within 24 hours. All right, so having done with this, let me go ahead and show you how your staff can clerk patient on this system. So I'm logging out of this pharmacy account to log into a staff account that they can use to manage your patient, and you have all the data streaming to your pharmacy account in real time. All right, so I click on PHA, and then I click on I'm not a robot. Always do this so that you don't have any issue logging in with it. So I log in. Now that I'm in, I click on this. So assuming we're going to assume that we're starting from scratch. Whenever you have a new patient, click on register new patient, and then fill this form for them. Once this form is filled, click on add patient. This patient becomes one of your patients, and it will be on the patient register. Then after this, go ahead and now click on attend to patient. Once you click on this, use phone number option. Simply ask the patient for their phone number. So in this case, we're making a demonstration. 08034891115. This is a demo account. It doesn't belong to a real patient. But the funny thing is that if you try to do what I've done now for this phone number, you are not going to get access to this folder, because it has a default password on that create account that you have to assign it when you are creating that account, that anybody who does not know it cannot use the phone number alone to fetch the folder. So in that case, I click on verify, and then I click on, you can review all that you have done for your patient previously on this system. You can see all the clinical documentation done previously. They are all here. So after reviewing what you have done, this will help you to provide more individualized and informed patient management. If you now want to create a record for them, simply click. You can even engage with them on communication. You can see I can send SMS, you can do live chat, you can do video call, you can do audio call. So you click on create new record. This is for you to create a file in their medical file. Create new record. You now click on whatever you want to do. You can do clerking. There are a lot of tools for you to do clerking. Patient complaint, medical history, just name it. Capture as much information as you can. during this consultation session for you to understand what is your patient need. Then next will be point of care. If there is need for you to maybe check the vital sign, glycemic control, kidney function, just name it, you have all the tools for you to do. Let me just open one for you to see what is there. Vital sign. So this is vital sign, and then you can see blood pressure. You can take the result 120/80 or whatever it is, and then it will even have reference for you, so you can reference it after putting the result. Like you put 120/80, you reference it 90/60 to 120/80 as normal. All right, so that is it. You can record as many of the vital signs as possible. Then these are all the various tools that are still under vital signs. Then there is pharmaceutical care too. When you go to pharmaceutical care, you capture objective data, subjective data, diagnosis, assessment and impression, treatment goal, pharmaceutical care plan, monitoring parameter, pharmacotherapy recommendation, intervention, outcome of intervention, medication recommendation, patient counseling, drug labeling, and all of that. So there is so much you can do with this too. Family planning, vaccination, pharmacovigilance, nutritional management where applicable, and even referral to other hospitals where the need arises. With these two, there is so much you can do to improve the quality of care we provide to patients in community pharmacy and even in hospital pharmacy. And we enjoin our people to embrace this development in order for us to better care for our patients, and even to improve the image of pharmacy profession at large. Thank you for watching. And for you to get more information, you can call us on +234 81 88 88 7036. I will be glad to assist you in getting to know more about this system. Thanks for watching up to this stage, and I believe with what you have seen, you can see there is a lot going on for us, and the future is bright if we can actually do this as a group. Thank you for watching. Bye.